Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Harsh Singh. He's general manager of healthcare at Genzeon. And Vinit Singhal, he's market segment leader, payers at Genzeon. And Jason Warrelmann, he's VP healthcare strategy at UiPath. Welcome, guys.
Thank you. Thank you for having us.
Thanks.
Excited
to be here.
Yeah, we're going to have some good discussion. I think it's the theme of this conference, automation and leveraging AI to improve automation. But before we dive into today's topic, Jason, why don't you start us off? Tell us about yourself and UiPath.
So UiPath since 2018, I have had the pleasure of being a part of our healthcare business and industry since then. Worked a lot in the strategy and working with partnerships and alliances. My job is to help organizations really understand the value they can get out of a platform, how it meets the needs of their health system, how it works and integrates with their partners, as well as work with strategic organizations like Genzeon to really break down those barriers and help customers accelerate.
Awesome. Harsh, how about yourself and Genzeon?
Yeah, thank you. Thanks, John. I think, first of all, excited to be here. I think I had the healthcare division at Genzeon, and we are focused on driving AI and automation value translation with working with partners like UiPath as we bring that opportunity list to payers and providers. And a good number of clients we met at the Vive conference, and they are excited that we are on this journey and happy to be here.
Awesome. And Vinit, how about yourself?
Yeah, Vinit Singhal, as you said, I lead the payer segment. Been in the industry for almost 2 decades, I think. But I specialize in trying to help my clients, payers specifically, solve complex problems. And I think as the easier automation has got done over a decade now, and with the advent of AI, the clients are looking at a combination of us to try to solve for the more complex, more difficult problems. And finally, technology has caught up to be able to give us that bright future. And next 20 odd minutes, we'll talk about it.
Yeah, that's awesome. So Harsh, why don't you kick us off? What are customers, both payers and providers, expecting from UiPath and Genzeon as agentic AI and automation continues to evolve? I mean, at a pace we haven't seen, I think, but what are customers expecting?
I think, I look back at the journey of payers and providers. I think I would say payers specifically last 10 years or so, they have invested a lot in resolving the inefficiency on the administrative overhead that payers had. And they've done automation. So automation is not new to them. However, what is new is their focus on clinical waste that has there, I would say last couple of years, they're starting to realize, yes, they've taken the admin waste out of the health systems, but they have not really had the same impact on the clinical waste side. So those problems, they are applying automation to. I would say providers, our last 2-3 years, haven't had the investment. I look at what relative to payers to put in automation. I think they are catching up. We are seeing a lot more conversations with the providers to take patient access, patient registration, back office problems, payment under payments that are happening on the RCM side. So a lot of real problems. I think to the point Vinit made earlier, these are complex problems, but certainly a lot of opportunity to make a difference to their bottom line. Yeah. Jason, what do you think?
Yeah, the reality is most organizations want to move out of this is a science project. And they want to now move into scale. They want to look at this as a strategic layer. Before it was, organizations would move into it as a strategic layer, and they were elevated as innovative. Now with the advent of AI and the acceleration, they're now seeing that they have to do this. It's a lost leader if you're not. It's not easy to move from science project to innovation at scale. And especially with the use case Harsh was talking about, they're complex. They're very complex and require a lot of change management, a lot of hands in the process, a lot of feet on the ground. Humans and technology need to work together to be optimal. And I absolutely see that as being where the expectation is now coming in is, I'm here, I want to be here, but I need to be here 10 years ago. So how do we close the gap? So that's where the process is.
That's interesting. I mean, you mentioned some things that are quite fascinating to me as far as scalability of the solution. Vinit, I'd love to hear some of your thoughts about this, but also like how do we ensure that the AI-driven automation delivers both scalability and ROI for these providers and payers?
I think one of the things that Harsh touched upon that last decade or so has been more focused on solving for the administrative burden. I think the theme that we are seeing now is all the payers and providers are trying to find a balance between access, affordability, and administrative burden. So the type of problems that we are seeing, like never ever before we have seen this kind of focus on patient experience, member experience, provider experience, that's all access. Never ever we have seen focus on the care gaps elimination, looking at preventive and proactive care determination. A lot of AI solutions are coming up which are now trying to work on point specific problems that are very specific to looking at a care plan of a disease and even working on availability of physicians and pushing it forward, right? Like nuanced problems, very point specific problems. So these are like broader picture items which are being looked at very point specific lens, and AI and automation ideas from larger platforms like UiPath or companies like us are able to piecemeal into boxes and then solve for those boxes at excellence. So not solving at a large problem in a large way, but breaking it down into boxes and then looking at automation, agentic, and a combination of both to solve for at scale.
Yeah. What would you add, Jason? I mean, I've seen UiPath and the number of things you're doing in healthcare, like he said, broken down into small things is massive. Talk to us about that ability to scale to the problem.
Yeah, so when we look at the platform, the software, the way it works is kind of table stakes and elementary at this point. Everything's low code, no code. You know, it's really easy to implement and drive. So what we've seen, it's not the technology problem, it's a change management problem, it's a business culture problem, it's a budget problem. You know, the great conversation we recently had said that automation, AI, innovation needs to be a burning platform. And you know, the burning platform is what we're seeing. And then what you start to see is people come out and say, I've tried pointed solutions to solve these problems. I've tried to take this old machine learning process or this Python or this NLP or all the technologies we've known over the years. We tried that, it worked okay, but now the rate of technology is where we could probably start to reduce that debt and replace it with something else and scale opportunities that previously we didn't see before. And that's very complex. And we're now seeing that barrier of entry reduced. So if I want to get into very complex documentation processes, I can. If I want to get into integrating multiple systems that weren't integratable before, we can. Why? Because humans were the great integrations. Now, if you automate the human to where they're doing the work of integration, you don't need that anymore. So now you see these very complex, long-running workflows that stretch multiple departments that you could take the abrasion out of the system. And that could be patient-facing, could be member-facing, could be customer-facing, name your persona and what process you're talking about in healthcare. 60% of processes in any healthcare organization, whatever side it is, has high automation potential. The question is going to be what the change culture is, what the aptitude is, and of course, what type of other technologies you have, but that's sort of minor once you look at the people assets that you have.
Well, I think what's interesting too is that you have this platform that can automate 60% of healthcare potential opportunities. That's interesting, but you also have to have the expertise and understanding of healthcare. Is that kind of what Genzeon brings to this partnership with UiPath?
Yeah, I think so. I think we have been lucky to be working with UiPath and to be selected as one of the specialized healthcare partners. I think our last 12 years of journey has been being an exclusive healthcare company, solving those domain problems. But now to be working with UiPath, bringing that knowledge, bringing that skill set and applying it to building those agents that, you know, as UiPath starts on that agentic journey, we are very excited to be right there with them on building those healthcare agents for physicians, for nurses, to the point Jason made. Whichever persona you talk about, the opportunity is so significant in terms of the workflows where we're talking about prior auth, utilization management, claims review, fraud, waste, and abuse. All these are real problems. And to the fact that we can take our knowledge and skill set and apply it on UiPath platform to solve those problems, it's game changing for us to be able to see that difference, and it's going to be game changing for our clients as well. So.
Yeah, go ahead.
Just 2 points to that, right? I think one thing that has changed significantly with the advent of AI and to some degree as automation has matured, is technology was always looked upon as an enablement arm. You would have technology plus human to solve the problem. Now when we look at a problem, we are looking at technology for excellence. That what is the best outcome possible of this process? Like for example, people are talking about not having prior auth at all. I don't think so there was ever technology available in the past for making that statement. Now it is part of a federal program in which we're supposed to make it happen in the next couple of years. So we're talking about no prior auth universe, right? So things like that. And the second thing is, not only we can solve complex problems, we are now arrived at a point where we can do role-based, persona-based, your individual journey-based automation AI. Like for example, we have physician copilot, or physician autopilots, which are designed specifically for physicians. We have nurse autopilot that are designed specifically for nurses, not only regular nurse that, for example, reviews complex claims review for a living. So there are autopilots available that end-to-end solves her life and gives 50% efficiency back. So very custom, rooted, specific solutions.
Interesting. Harsh, you mentioned agentic AI. I think that's a popular topic we're hearing a lot now. Talk more about how these automation capabilities, agentic AI with UiPath and Genzeon, how are they making the process more intelligent and adaptive to be able to do what he's talking about, which is, could we get rid of prior auth or at least automate prior auth? How is it becoming more intelligent and adaptive?
Yeah, I think one of it is the tech itself has evolved quite a bit. I was listening to NVIDIA CEO talk about everybody having their own virtual assistant, right? Everyone having their own custom assistant, to the point that Vinit was making. But it goes beyond personas. It goes into me as an individual, right? What do I want specifically, right? And I think to the point now that agentic AI is allowing you to be able to create a level of orchestration of, okay, maybe somebody's really good at, if I was to take a simpler non-healthcare example, booking a hotel, or somebody's really good at planning a trip or booking a flight. But when I want to go somewhere, I want to go to Hawaii, I don't need one of them, I need all of them to work together. And that orchestration is one of the things we are quite excited about to partner with UiPath, because they are bringing that orchestration layer across all these agents. So they work together to solve the complex problems that Vinit was talking about earlier, which makes it real. And I think that's quite exciting.
Yeah. Well, I even saw a demo of UiPath doing your schedule for you across all of those. So that's happening as well. So I think we'll be able to use it for ourselves. That's interesting. I think the other interesting question is, how do healthcare organizations strike the balance between this AI-driven decision-making, agent-driven automation, and kind of human oversight, which in healthcare is always concerning. How do you see that? I mean, you're all about automation. How do you balance human versus automation?
So what's great about agentic, and we talk about agentic design again, the whole premise is human interaction, humor in the loop, right? We want to take as many steps out of the process that the human has to do that is abrasive, but there's a lot of pieces that we need to do for contextual reasons, right? We need to be the decision makers, right? Technology could be a great decision support tool. It's not the decision maker, right? It might make a recommendation. I might decide to go a different route. So a person's intuition, their experience is really where the balance is going to come in. Because to be able to engage with these agents, drive automation, I can get that great productivity lift of automation. I can get that great inclusion and research and audit that agents will bring to me. But then at the end, the real work, the value-based work, if you look at the actual process demography of what your job is, there's value-based, value-add processes. That's the job I want to do. All that MVA is what everything else did. So, really where the technology comes in and allows for that interaction in different forms. This is where the persona comes in, because some might like to do it through conversational AI, some need to do it apps, some need to, the flexibility to now build persona-based, really applications that are automation and agent-driven is the highest it's ever been. So I can walk in there and be like, this is how we want to build it, but how do I want to experience it? And that's how you drive in the innovation. It's the old design thinking philosophy when building applications. It's back, it's stronger than ever. Wow. And we have to build agents around that.
Interesting. Vinit, what would you add as far as balancing human and making sure we trust the agent and know when, hey, like you said, let's reach out to a human for this decision-making point?
I think in clinical settings right now, I think the farthest we can go is what Jason said, decision support. I think at no point in time in future, in the next couple of years, we are seeing that getting automated or getting eliminated. But I think the way to understand it, I think, and it got covered in a couple of sessions as a theme here, is that the intent of AI and automation and by and large technology right now is to have a doctor be the best doctor in the specialization that they have. So focus on, like, if you are a cancer specialist who is a surgeon, spend as much time of your day in solving patients' problem that you only have specialization. Anything around administrative or any administrative type of work or access kind of work that you're spending energy in, that is now being given back to you. And I think that can solve, by and large, I think you spoke about it a little bit, access problem to a large extent. That would also feed into the total cost of care, which US touts to be the highest in the world on, and I think there is a lot of focus around that. So I think, yeah, that ability to augment your individual role in spending all your energy in what you're good at, I think a different example to what Harsh gave, I think is what this entire technology translated will bring to customers.
Yeah, that's awesome. So Harsh, I mean, we're here with a lot of healthcare organizations. We've talked about a lot of, really important concepts, but how can organizations really drive that kind of enterprise, in production, AI, and automation and value today rather than, okay, a couple of years from now, prior auth may be improved, right? Yeah. Like, what are some stuff they can do today with these automations and really see an impact?
Yeah, I think one of the things that I feel like organizations are ready for are looking for partners who have already done this in some way. They have a playbook, they have a solution kit, they have solved that problem. So when you go to them, you're not starting from, hey, here is an idea. Mm-hmm. I think the idea stage is over. I think that's what was last year. I think people ran a lot of POCs, they experimented a lot. I think this year is the stage of, okay, show me the money, okay? Have you done this? Show me a solution kit. How can you bring that to market in 3 months, in 6 months? I need the ROI this year. I don't need ROI next year. It's not a promise I'm looking for. I'm looking for results. And I think as companies like Genzeon, UiPath, we have built solution kits for solving these problems already. So we feel like when somebody comes to us, it's not a promise. It's an outcome that we are committing to. And we are willing to go commercially on that at-risk model where we'll say we will deliver this outcome. And I think that's the journey where our clients are. And I don't know, Jason, if you have heard something different in the conference, but that's what we are hearing from the clients today.
I mean, at the end of the day, to your point, they're not asking, can you do it? They're saying, how you do it.
Yeah, you got it.
How is the most important word? Yeah. It's the biggest challenge in technology or consulting selling is the how. We have frameworks, we have best practices, and they lend credibility. Mm-hmm. But if you've built it with customers, you've done repeatable processes, you have people on staff that have done that. Yep. Genzeon, because a lot of their people came from some of our earliest center of excellences across our healthcare customers. The how becomes super important. Mm-hmm. And if it sounds like, from a Genzeon perspective, talking to an end health organization, that the language Genzeon speaks sounds like one of their VPs, one of their directors, explaining the how of how they're going to take this budget and deliver this outcome with a software that they already know is good, but the people part is a risk. It just lends so much credibility, and it accelerates timelines, that accelerates return. And return isn't always productivity, it could be quality. Agents are about quality. So that's really the vital piece here, is that how.
Interesting. What are the most common places that they're applying this? Are there, I know you work across a wide variety of healthcare ones. Are there some, favorite areas where people start, or?
Yeah. So, I mean, we're talking a lot about providers, payers. We talk life sciences too, but on the providers, revenue cycle management's been around for a long time. Everyone's automating it. We certainly do it. But every time something like agents come out, the interest ramps up again. There's always cash to collect. There's always revenue to recognize. There's always DSO to reduce. Yep. You know what I mean? So but what we've seen is like where it's back office, very kind of back office revenue cycle, which is, claim to cash. We're seeing it come upstream now to patient access, which has been very complex. You can't really standardize it very much. You can, but you can't. This is where the renewed interest is. Now we can stop the bleeding before the claim gets done. Proactive, not reactive. We're seeing supply chain come back in a big way. A lot of people did their big ERP pushes and did a lot of their transformations. Now they want to optimize. Finance is always key. HR is always key, especially with the health market and the movement of clinical resources. And then, of course, you get into the clinical workflows, especially around EMR optimization. A lot of organizations going through EMR upgrades and migrations. The cost of that is going up considerably. There's a lot you can automate before. There's a lot you can automate through migration. There's a lot you could do post-migration. There's this concept of clean core. The more standardized you can get the standardized processes, the less expense you'll have in the future. Sure. These are very big opportunities. And then you stretch that to the payer space. The audits, the research, these sort of people-heavy processes, utilization management, right? Very clinical, very expensive people looking at administrative work to be able to reconcile and improve risk and revenue integrity. The question is, do you need these high-end clinicians to do that? I'd rather put them on clinical programs and take better care of our patients. Could I have an administrator with a tool that gives them the kind of sense of a clinician, lower the barrier of knowledge management, increase the quality, and create outcomes? So utilization management, claims are coming back in a big way. 100% claims is awesome. Contact center is going through another evolution as well. So every aspect of the business is reevaluating and saying, now that we have agents, now we have more aggressive AI, we have strategies around this. Can we look across our landscape, look what we did the last 2-3 years, and bring the bar up? And so it's like, where do you start? Start where the money is, typically what affords the program, and you work up to the other areas so that you have strong champions that want to support the program.
That's interesting. I would almost ask the question, is there anything that can? But it's nice to know where to start. Yeah. Harsh, anything else you'd add as we kind of wrap up?
No, I think one of the key things is, to make it real in your day-to-day life, right? I think understanding, not just in the healthcare space, a lot of folks want to say, hey, this is something complex, I don't deal with it. I think the way I would phrase it to folks is, when you're talking in human and agents together, I think, yes, we want a GPS to tell us which is the fastest way, but nobody's going to tell me that I want to stop over to get a boba tea for my daughter, right? That's not going to happen. So that's the aspect of human and AI working together. And I think keeping that simple in our minds will help us think through how we apply this technology in clinical workflows and in healthcare. So.
Yeah. Maybe an advertising opportunity though, if they promote the boba tea, I don't know.
I had to call out to my daughter and make sure I talk about boba tea for her. So, yeah.
No, you're right, but it is a good point. It is a balance of human and the technology and applying it the right places and then getting the buy-in so that they trust it. So that's fascinating. Cool. Well, I appreciate you guys joining me and taking this time to share about Agentic AI and the partnership between Genzeon and UiPath. Really fascinating stuff. And thanks everyone for watching and listening.
Thank you so much.
Thank you.
Thank you.
If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks a lot.
Thank you.